Good afternoon, everyone. I'm Christine Elliott, Deputy Premier and Minister of Health, and the MPP for Newmarket Aurora. We would first like to welcome our Minister of Transportation, Caroline Mulroney, who is also the MPP for York Simcoe, York Region Chairman and CEO Wayne Emmerson, York Region General Manager Lisa Gonsalves, and York Region Paramedic Services Chief Chris Spearen for joining us today. Thank you. I would also like to sincerely thank each of you for your ongoing efforts to protect the health and well-being of the York Region community. I know that this past year has been particularly difficult in pretty much every way. York Region Public Health and our incredible paramedics, though, have been working around the clock to keep our communities safe and healthy. That includes reaching out to our most vulnerable homebound individuals who cannot travel to a mass clinic to receive their vaccines. These efforts are essential to ensuring those who need the vaccine the most can receive it safely and conveniently without having to travel to a mass immunization clinic. Thank you so much for your tireless contributions during these truly unprecedented times. Our government has always been committed to protecting the health and well-being of all Ontarians. That means building a healthcare system that is centered around patient needs and choice, offering a seamless patient journey between service providers and putting an end to hallway healthcare. As we continue to fight the third wave of COVID-19, this commitment takes on even greater significance as we work with all our health system partners to relieve the pressures facing our hospitals. Ensuring that patients can receive the quality, timely treatment that they need and deserve at home or in the community is critical in these efforts. That's why we are proud to announce today that we are introducing an innovative 911 model of care pilot project in York Region and to over 30 municipalities across the province. These pilots support eligible palliative care and mental health and addictions patients. Our York Region Paramedic Services will be implementing the treat and refer model for palliative care patients. Currently, if a patient is experiencing palliative care challenges and calls 911, they must first go to an emergency department before being transferred to a community-based care center to receive treatment. This means patients could be forced to wait hours before receiving the care that they need. In York Region's pilot, eligible palliative care patients who dial 911 have the option to receive treatment at home by specially trained paramedics who can administer a range of medications to address their symptoms. Paramedics then directly coordinate with the pilot's primary palliative care team or with a local hospice where the patient is registered to ensure they are able to receive longer-term supports and wraparound care. This means patients receive the timely and effective care they need, when and where they need it. And these models enable our world-class paramedics to support our most vulnerable patients in the appropriate care setting while avoiding unnecessary emergency department visits and relieving hospital capacity pressures as we combat the third wave of COVID-19. This new pilot will be in place for 1 year, where it will then be evaluated to determine whether any necessary adjustments are needed. Today's announcement is yet another step as part of our government's commitment to improve patient care in our communities, support hospital capacity, and end hallway healthcare. I am incredibly grateful to York Region and York Region Paramedic Services for taking on this exciting opportunity. I would now like to pass it over to York Region Chairman and CEO, Mr. Wayne Emmerson, to provide his remarks. Thank you all very much.
Well, thank you, Minister Elliott and Minister Mulroney for joining us today. I really hope your families are well and staying well. On behalf of York Region Council and the Regional Municipality of York, I extend my appreciation and thanks to the province of Ontario for your continued commitment to the health and well-being of our 1.2 billion residents. As you know, York Region is one of the fastest growing and most diverse communities in Ontario. As our communities grow, it is the job of all levels of government to look to new and innovative ways to meet the changing needs of our residents. York Region is pleased to pilot this one-year project that reimagines the way we care for some of our most vulnerable residents. York Region Paramedic Services has always been a leader in patient care, and I can say they're probably the best in the country. And we are honored to work with the province to provide residents with the option to receive palliative care and end-of-life care in their homes. Now more than ever, it is important our integrated healthcare system allows residents to get care they need, when and where they need it the most. Undertaking an initiative like this takes skill, dedication, and compassion. I'm very proud of our paramedics, whose commitment and intense training permit them to deliver broad-based community care that goes beyond traditional emergency response. By enabling eligible palliative care residents to receive care in their own homes instead of emergency departments, we are collectively supporting our hospital partners at a time when capacity is so critical. Finding new ways to strengthen and support our communities aligns with Regional Council's commitment to support community health, safety, and well-being. Thank you to our dedicated York Region paramedics for your ongoing and support, especially in this time of great need. And thank you to our provincial partners for launching this innovative model of patient care here in York Region. Your continued support is helping build a strong and caring and safe region for all who call our communities homes. Thank you, Minister.
Thank you, Chair Emmerson. And now we'd like to ask Lisa Gonsalves to please say a few words. Thank you.
Thank you very much, Minister, and good afternoon, Minister Elliott and Minister Mulroney. I want to also extend my appreciation for being here today and for the continued support to improving models of care and patients' lives. As the General Manager for Paramedic and Senior Services here at York Region, I'm uniquely positioned to support the critical work of our frontline and community paramedics and provide essential programs and services to help seniors at all stages of life. We strongly believe that seniors deserve the very best care and support we can provide, and that is why we've developed a York Region Senior Strategy. One of our most important objectives is to connect seniors and caregivers to the right services at the right time. And this new model of care aligns very well with this objective, as it will help us reach this goal by optimizing paramedic resources to ensure our seniors requiring end-of-life care also have access to appropriate and timely health care when and where they need it the most. Thank you to the province of Ontario for your support and to everyone who has worked extremely hard to help this pilot get off the ground. I did want to acknowledge two special people. I'd like to thank Dr. Susan Eckensbeller and Init Trivedy, as they are the dedicated team within York Region Paramedic and Senior Services who have helped prepare for this pilot project internally by developing a curriculum in partnership with the base hospitals, as well as a cohesive training program to help prepare our frontline paramedics for the launch later this summer. I'd also like to mention the Canadian Partnership Against Cancer and Healthcare Excellence Canada, formerly known as Canadian Foundation for Healthcare Improvement, who provided funding for this project. And of course, we couldn't do this without our frontline paramedics, who, despite all the challenges they have faced throughout this pandemic, continue to amaze me with their ongoing commitment to improve patient care in our communities. At this time, I'd like to introduce and invite our Chief of Paramedic Services, Chris Spearen, to speak more about this new model of care. Thank you, Minister.
Well, thank you, Lisa, and thank you, Ministers Elliott and Mulroney. On behalf of York Region Paramedic Services, I too would like to thank the province for its ongoing support to improving patient care. By providing paramedics with these additional options to treat patients safely and appropriately, we are taking great steps to improve care for our patients when and where they need it most. Evidence shows that having paramedics provide palliative care and end-of-life care in the home improves comfort and quality of life for people with debilitating illness, and as well as their families. Beginning this summer, eligible palliative care patients in York Region who call 911 will have the option to be treated on scene for pain and symptom management by trained York Region paramedics. This will enhance patient choice by allowing the patients to choose where they receive their care. Enabling paramedics to provide palliative care at home will benefit patients and healthcare service providers across the system in many ways. For example, patients will have access to 24/7 supports. Paramedic services will reduce transport to hospital, which will help keep offload times within target. Hospitals may see a reduction in avoidable emergency department visits and admissions, which will be critical as stress on hospital capacity is at an all-time high. Our role as paramedics will always be centered around improving the health outcomes of our residents and developing a stronger sense of community. I know I speak for all members when I say that I'm grateful to the province and our partners for this opportunity, and I'm very proud to be part of this inspiring initiative. At this time, I would like to welcome Minister Mulroney to say a few words. Thank you.
Thank you, Chief Spearen, for that kind introduction. Good afternoon. It's great to join you all today. And a special thank you to Minister Elliott for making today's announcement happen. This is welcome news for the people of York Region and for my riding of York Simcoe. The health and safety of Ontarians remains our government's top priority. We continue to deliver better coordinated, connected patient care by modernizing Ontario's emergency health services system in order to improve access to the right care at the right time and to end hallway healthcare. Because nothing is more important than the care of our loved ones. By enabling patients to receive care outside of an emergency department setting, we're also supporting Ontario's health system response to the third wave of COVID-19 by relieving hospital capacity. And that's never been more essential than it is right now. The new models of care enhance patient choice by enabling eligible patients to choose where they receive care, either at home by specially trained paramedics or in a community-based setting, or in an emergency department. The pilots announced today benefit eligible patients experiencing symptoms of mental health and addiction and palliative care patients. Today's announcement is part of our government's efforts to improve access to the right care at the right time, communities across the province, including our very own York Region. We're putting an end to hallway healthcare. Thank you.
Thank you, everyone. We'll now move on to the media Q&A. A reminder for members of the media that it's one question, one follow-up. Operator, first question, please.
As a reminder to press *1 if you do have a question. First question will be from Travis Danraj at Global News.
Hi there. My question is for Minister Elliott. Minister, we understand that the government has made a formal request for assistance from the Red Cross and the Canadian Armed Forces. I am just wondering if you can tell me why this was not done sooner, and also what help you have asked for and whether or not you have received a response from the government on this and when we could see boots on the ground.
Well, thank you very much for the question, Travis. Yes, we have requested some assistance from the federal government to help us with a request to the other provinces and territories, and also to see if they're able to send us any further supports in terms of personnel from either the Canadian Armed Forces or the Red Cross. As you know, we are seeing increasing numbers of people in our intensive care units. And as we are building more beds, we have created more spaces. We have set back and delayed some of the emergency surgeries and procedures, but we are still in need of some more health human resources, although we've extended them considerably from within. But we have asked Minister Blair for this assistance, and we are still waiting to hear from him with respect to his response and whatever he's able to help us with.
Follow up?
Okay. Yeah, I guess it's the initial question. Why wasn't this request made earlier? We knew that, capacity was an issue when it came to ICUs for weeks now. The trends have been going in the wrong direction. Why didn't the government of Ontario ask for this help sooner?
We have been having discussions with the federal government throughout. We have also been making our own requests of some of the other provinces. This is just a way really to get more assistance, if possible, from the Red Cross, which had already been offered before, and with the armed forces. So as you may know, we are receiving assistance from the province of Newfoundland. They are sending a team of people tomorrow to Ontario, including Premier Fury's wife, who is a critical care doctor herself. So we have been reaching out to other provinces, territories, and other jurisdictions. So this is another reach out as we are building our health human resources team, both to supplement what's going on as we're creating more intensive care beds, but also to provide some respite for some of our frontline professionals who have been doing an amazing job over the last year, but they need some respite as well. But this has been an ongoing procedure. We've been working on this for some time now.
Operator, next question, please.
From Megan Dallaire at Metroland. Please go ahead.
Thank you. Hi, this question is for Minister Elliott. Minister Elliott, a year into this pandemic, healthcare experts have criticized the provincial government's response to the crisis in long-term care, saying the province isn't moving fast enough to vaccinate long-term care staff and caregivers, that its timeline for achieving a 4-hour standard of care by 2024-25 is too distant, and that the rate of training and recruiting new staff to the system doesn't match the pace at which the province plans to add beds and residents to the system. So I'm just curious to know how the provincial government responds to these criticisms.
Well, we have been able to have an amazing success rate in terms of vaccinations for the residents of our long-term care homes, retirement homes, and other homes of congregate living. Well over 90% of the residents have already had their vaccines, as well as the staff. We are also making sure that essential caregivers can also receive their first vaccines. And because of that, we have fortunately seen the death rates drop dramatically in these places, which is what this is all about, is saving lives. That is our primary commitment to the people of Ontario, is to protect their health and well-being, especially those who are most vulnerable. And I would say that our residents of long-term care and retirement homes are amongst the most vulnerable, and those receiving home care as well, which we're helping with this announcement today. I know that our colleague, Minister Fullerton, is working very hard on making sure that we have the levels of staff in our long-term care homes, and she's brought in a program of helping to train more people to work in our long-term care homes. We're also, of course, really waiting for the result of the report of the Commission into long-term care. So we are, notwithstanding that, we are moving forward. We are making changes. We have reduced the room sizes, for example, from 4 people, where there used to be quad rooms, now into just for 2 people for infection prevention control. But as I said before, the large majority of the residents of these homes have already been vaccinated and are now protected.
Follow up?
Thank you. Yeah, so what are the main factors, I guess, keeping the province from meeting the 4-hour standard of care earlier, when, advocates have been asking for it for, I think, 10 years now?
Well, I think it's important to note that we are the first government to have actually made that commitment. Many governments have talked about it, but we are actually going to do it. One of the impediments right now is health human resources, because if you're going to increase the hours of direct care to 4 hours a day, we need many more trained professionals, and you can't just manufacture them. They have to go to school and be trained. So we are calling on many young people now to consider working in our healthcare system as a career, whether it's as a PSW, a registered practical nurse, a registered nurse, or as a physician, or one of any other number of therapists. We need everyone. And that is going to take several years until we have enough people trained to be able to provide that care. But we are moving forward on that, because that's a commitment that we made to the people of Ontario. And this is very important. This is a system that's been languishing for some years. And we are going to make sure that we have not just the beds, but the health human resources as well.
We have no more media on the line. So with that, that concludes today's announcement. Thank you so much, everyone.
Thank you very much for being involved today.